Good morning, everyone. I'm Anshu Banerjee. I'm the Director for Maternal, Newborn, Child, Adolescent Health and Aging at WHO. And it's a pleasure on behalf of the
Es un
co-host.
placer ser coanfitrión de esta sesión entre USAID y UNICEF por venir, por su presencia en esta reunión de alto nivel en la asamblea y estamos buscando llegar a un futuro libre de exposición al
de l'exposition des mères et des enfants.
This high-level panel event aims to elevate the global health community's attention to the challenge of lead exposure with a view to galvanizing
reto de
cross-sectoral collaborative action needed to address this. As countries intensify
países. Vamos a intensificar
pour assurer les
health impacts posed by exposure to toxic lead impedes their progress. Globally, an estimated 1 in 3 children, so approximately 800 million, suffer from elevated lead levels that necessitate public health action. Lead is a prevalent and potent neurotoxin to which there is no safe level of human exposure. For example, during pregnancy, lifetime cumulative exposure to lead can be passed on to the fetus. It can cause increased pregnancy complications. It can elevate risks to leading causes of neonatal mortality, and as a consequence of that, lead to reduced fetal growth, lower birth weight, preterm births, as well as stillbirths. In addition to the severe cognitive development impairments and poor educational outcomes resulting from lead poisoning, children with elevated blood lead levels are also at high risk of poor health outcomes throughout their lives. So, despite this, to date, the global health community's attention to the adverse and far-reaching health impacts of lead exposure and measures to prevent it have been very limited. Addressing this major challenge requires a concerted, whole-of-government, multisectoral approach involving not only ministries of environment, industry, education, economic growth, but also regulatory agencies and also ministries of health. So I'd like to call on Dr. Atul Gawande, the Assistant Administrator for Global Health at USAID, for his opening remarks.
Thank you, Anshu. Thank you for your partnership at WHO and leadership. The UN system has been a vital component of bringing to awareness the concern about this work and taking action, and that's through WHO, UNICEF, and the UN Environment Program. Grateful to you, Anshu, also for chairing this session. On behalf of the United States delegation to the World Health Assembly, on behalf of USAID and also our esteemed co-partner in UNICEF on this session, represented by Ted Chaiban. Let me thank the Honorable Minister Pate for joining in this panel. Also, the Additional Director General of Health Services of Bangladesh and the Vice Minister of Health of Vietnam for their leadership in showing the way in this important line of work. Many thanks to also the other speakers and panelists. We have from Africa CDC, Dr. Mohammed Abdul Aziz, a partner in multiple lines of work for us as the head of the Division of Disease Control and Prevention of Africa CDC. We'll be joined virtually by Dr. Howard Hu, a globally recognized lead expert from the University of Southern California, and also note his dedication in taking this in the very early hours of the day and late night in California. And then also Laura Ibanez, country director of the Philippines for Pure Earth, and an ardent advocate of efforts to prevent lead exposure, who's at the other end of the spectrum, joining us virtually from a time zone 12 hours in the other direction. And welcome to all of you here in this audience, but also online where we have hundreds of people who have joined as well. This is an important topic, and I want to emphasize it because it's a rare example of a massive impact problem, a problem that has been neglected, and a problem that is also highly tractable. This is an issue for which I had little awareness until a couple of years ago, when we really began looking at USAID, at where in a flat-funded environment we could have the potentially largest impact on health outcomes. And lead rapidly rose to the top of the list for reasons I will discuss. The wake-up call in the United States was when children in the city of Flint, Michigan, were found 1 out of 20 to have elevated lead levels. When we thought
Revelaron tener altos niveles de plomo en la sangre, 1 de cada 20 niños. Pensamos pinturas sin plomo, gasolina sin plomo. Este es un problema que ya pensábamos resuelto, pero resultó que no. Y fue entonces que el presidente Biden tomó esto como uno de los temas principales de la agenda. Y bueno, la gente que se dedica al medio ambiente y la salud desde hace tiempo sabe que los niveles de impacto
20 children, that was the wake-up call for the United States in Flint, Michigan. As you heard, it's 1 in 3 children in the world. It is 1 in 2 children in low-income countries. 90% of the problem of lead exposure around the world is in children in low-income and middle-income countries. Second, the impacts are extraordinary. The educational and cognitive impact on children is that currently in low middle income countries, the lead level of the average child is high enough to reduce IQ by 6 percentage points. That is sufficient that if you're moving the entire intelligence curve to the left for your population, that means you have a 60% increase in the number of intellectually disabled children, and you've reduced the percentage of gifted children by 60%. That alone is a damage to the future of our world. Second, however, was what Anshu mentioned, was the evidence now that there are multiple pregnancy complications from the accumulation of lead in your body later in your life, including increased levels of preterm birth, low birth weight, and stillbirths, and causing harm in the development of the fetus in utero. Add to that the newer data over the last decade demonstrating that lead is a major driver of atherosclerosis. Last week, the global burden of disease estimates from the Institute of Health Metrics and Evaluation came out, and they have upgraded, because of this recent evidence, their estimates of the number of deaths associated with lead. They estimated 1.5 million increased deaths around the world from lead. This is on par, in fact, larger than TB, larger than malaria, and yet we have not exerted the same level of focus in the health community as we have in these other spaces. It's also going to be impossible to take on our burden of non-communicable diseases, given that the major way in which lead can kill because high lead levels can be directly poisonous to children, and you can have children die. But the massive numbers are premature cardiovascular disease, and that is a huge opportunity. Let me then just say that the goals here today are to bring awareness and to hear from our country ministers about the activities they've taken so we can understand the pathway for taking action. We have done it before Samantha Power, the USAID administrator at the World Economic Forum in Davos, outlined a vision of a world that has a future free from lead exposure. It starts from the demonstration that with very low amounts of investment, we were able to remove lead from gasoline around the world. Now, in the high-income countries, 90% of high-income countries have signed on to removal of lead from paint and other consumer sources, but that has not happened at the middle-income and low-income levels, and it's leading to a major inequity in survival and in educational attainment and other outcomes. And so we have joined the Global Alliance to Eliminate Lead Paint at USAID, becoming the first development agency to join the Global Alliance. We've joined along with the U.S. Environmental Protection Agency and the CDC, and we encourage those in the development community and in the health world to join that effort and to participate in work that you'll be hearing about on major sources of lead exposure, which include household items like spices, paint, cosmetics, and cookware. So with that, I'm going to turn this back or onward to our next colleague. I want to introduce Howard Hu, whom I mentioned, a globally recognized expert on the relationship between environmental factors such as lead and the impact on disease and development in the population. He's the Flora L. Thornton Chair and Professor of the Department of Population and Public Health Sciences at the Keck School of Medicine at the University of Southern California. And thank you again, Dr. Hu, for joining us in the middle of the night. We're so grateful for your dedication, all that you are discovering and teaching the world about these connections and what you will present today. Thank you.
Thank you so much, Dr. Gawande. And of course, I'm so honored to be here. Let me just share my screen and get the slides going. All right. Well, first, greetings to the honorable health ministers and other ministers and dignitaries and friends around the world. I first want to say that the insights that I share today are the result of hundreds of scientists working on this problem for decades. That include every possible discipline you can imagine: chemists, toxicologists, epidemiologists, physicians of every type. And of course, policymakers as well as health economists. I had the great privilege of serving as a consultant for UNICEF and doing some of the research that led to some of the insights shared by our colleagues. The estimate of one in 3 children having blood levels over 5 micrograms per deciliter is notable because 5 micrograms per deciliter is really just a benchmark for trying to understand those with fairly high exposure levels, but in fact, we have not been able to find a threshold of blood lead below which we can't find an effect of lead on IQ. So the real bottom line lesson from all of the research that's been done on lead, learning, and cognition is that we got to keep the levels as low as possible. Getting under 5 would be nice. Getting under 1 would be ideal. This is, of course, the kinds of insights that's led us to understand the impact on the learning gap between rich and poor countries, and the health economists to project how much of a drag this is on the global economy because of the importance of cognition, intelligence on the economies of the world. Now, the insight that these are blood levels that are increased across the world, of course, belies the fact that there are inequities. This map clearly shows how there's some countries, and we know that there's health ministers here from sub-Saharan Africa, where a lot of the lead exposure is occurring above 5 micrograms per deciliter, above 10, even 15. And some of that relates to the very things that Dr. Gawani mentioned, whether it's spices or cookware, but it also relates to industries such as electronic waste recycling, the recycling of automobile batteries. These are some of the sources that the NGO Pure Earth has been dedicating its mission to try to understand and alleviate around the world, but there's so much more work that has to be done. Now, as a scientist, and so for those of you who have been in the health sector, it's important to appreciate that lead's impact on health relates to its ability to serve as a toxicant at the very tiniest levels. It is a so-called xenobiotic. Unlike so many other elements, it has no useful purpose in the body. And among the mechanistic processes that it engages in is amplifying oxidative-related damage all over the body, which is essentially equivalent to accelerated aging, which accounts for some of its cardiovascular impacts. But it also has a special predilection for interfering with neurologic transmission, and this is what's depicted in this figure. Part of its impact is related to its ability to mimic calcium, which is so important because there are calcium-dependent enzymes all over the body. But it is an imposter. Although it looks like calcium to the body, it doesn't act like calcium, and it interferes with all the calcium-related enzymatic processes, whether it's protection of cardiovascular elasticity, prevention of calcification, and all the other things that lead to hypertension and oxidative stress to the cardiovascular system, but also interferes with the process of synaptic development in the brain, which is exactly how we fear is the mechanism by which lead, even at the tiniest levels, creates noise in the sensitive development of brain synapses that underlies intellectual development. Now, on the left here is a depiction of the various levels of blood lead and some of the health effects that can be expected. But the take-home lesson here is that up until 30 micrograms a deciliter, the usual person who's exposed to lead has no symptoms at all. So this is an invisible, asymptomatic toxicant, and that's what allows it to invisibly affect children, decrease IQ, affect academic achievement. It also contributes to behavioral problems. We're worried that it also increases the incidence of violent behavior. It leads to delayed puberty, reduced fertility, and then once you're over 30 micrograms per deciliter, then symptomatic lead poisoning can occur. Even then, it can be difficult to recognize because the average person with severe clinical lead poisoning will just present with abdominal pain, sometimes weakness, and in its most severe manifestations, seizures, encephalopathy, and death. Now, on the right-hand side of the slide is the special attention we have to give to pregnancy, because in fact, lead crosses the placenta without any problem. So lead exposure to the mother can affect the child, and lead exposure will increase the risk for preterm birth and spontaneous abortion, as mentioned. But in this slide, we try to understand more of the dose response, because on the left-hand side of this figure is the pooled results of an international analysis of 7 very rigorous epidemiologic studies done all over the world, showing you the dose-response relationship between blood lead levels on the x-axis and the IQ decrements that are sustained over time. And what you can see is that the model curve shows that there's no real threshold. In fact, it's even steeper at the very lowest levels, where beginning at around 1 microgram per deciliter, you're already losing points of IQ, going down to 5 and beyond. That underscores the importance of reducing lead exposure as much as possible. And on the right-hand side is a figure that appears from one of our research group studies looking at the relationship between blood lead and indices of behavioral abnormalities. And you can see even with blood lead levels going all the way down to 5 micrograms per deciliter, we can see this dose response related increase in abnormalities of behavior, whether it's inattention, attention deficit, even things like depression and anxiety. Now, the pregnancy issue also has a special attribute because the lead exposure that comes from mother to fetus not only comes from what the mother's exposed to during pregnancy, but actually what's been collected in her bones. As it turns out, the skeleton is the major reservoir of lead exposure in the body, where lead substitutes for calcium in the hydroxyapatite mineral structure of bone, and it builds up over years. And then during pregnancy, the mother's skeleton is literally dissolving itself to provide calcium to the fetus so it can grow its own skeleton. Out comes lead with the calcium, crosses the placenta, and it turns out it is an independent predictor of poor intelligence later in life for the offspring. That's even independent of the blood levels in the children. So now we have an unmeasured exposure risk to the fetus, a transgenerational toxicant, and we're able to do this kind of research because now we have tools to measure lead in bones and follow the activity and the pathway of lead from mother to fetus. Transgenerational toxicants is a scary business. These are some of the results that we've seen. We've actually been able to measure maternal bone lead, and shows that it's correlated with declines in offspring IQ at age 3, age 6, age 9, age 12. And again, these are lasting effects for the children. This is the title of a study published in the New England Journal of Medicine 20 years ago, the results of one of the most rigorous multi-center randomized controlled trials ever done for a treatment of lead exposure using chelating agents. What chelating agents do is that they latch onto lead and other metals in the body, and they escort them out of the body, usually by urine. But the result of this multi-center trial is that, in fact, there was no appreciable improvement in IQ. In other words, the brain damage from lead exposure in kids is for the most part irreversible, which underscores the importance of prevention. In terms of the adult dimension, what we've been able to ascertain in studies like this one is that even relatively low blood levels here, again on the x-axis, going below 5 micrograms per deciliter, below 2.5 micrograms per deciliter, incremental increases in blood lead are associated with increased hazard ratio risks of dying, heart attack, or stroke. This is from the National Health and Nutrition Survey in the United States, one of the largest population representative studies in the world. 15,000 adults followed year after year, and the current estimate is that lead exposure may be responsible for about a third of the heart attacks that are occurring in this generation of adults who've been exposed to lead for many years. This is one of the studies our group did that is part of the evidence base. We measured bone levels, again, an indicator of cumulative lead exposure over time. And this is among community dwelling adults, not occupationally exposed to lead, but just exposed to lead because of the environmental exposures from lead in gasoline, lead in paint, lead in water. And we found that among these adults, if they happen to be in the top quartile, that is the top fourth of bone lead, they will have doubled their risk of hypertension. Now, this is not just in men. We also did this study among nurses, in one of the largest study of nurses around the world called the Nurses' Health Study. We brought in over 600 of them for measurements of bone lead, found plenty of lead in their bones, again, from environmental exposures that were historic in the US, but unfortunately continuing not only in the US, but of course in the low and middle income countries that we talked about. We found the same thing. The women with the top quarter of bone lead levels will have doubled their risk of developing hypertension. And as we know, hypertension is one of the major risk factors for cardiovascular death. This is the kind of data that health economists have used to link with all of their knowledge about what is the value of IQ points, what is the value of losing life in middle age due to cardiovascular disease. Enough for these health economists to estimate that the blood levels that are seen in low and middle income countries may explain the 20% learning gap that may exist between rich and poor countries, and to estimate that 6.0 trillion US dollars was the global cost of lead exposure. If you put this all together, the children's lead exposure and the adult lead exposure and the cardiovascular impacts, that's huge. What is the role of the health sector? And that's part of what the discussion will be today. The health sector clearly needs to understand the scope of the problem itself. Atul Gawande is not alone. Many of my colleagues, and in fact, many of our own environmental health colleagues, were unaware of the continued threat that lead exposure still exerts even after we have phased out leaded gasoline, but because of all of these alternative sources of lead exposure that have persisted or that have even grown, particularly in low and middle income countries. So we have a responsibility to increase awareness and advocacy, but because lead exposure is invisible and asymptomatic, we also have to take the lead in screening and testing, taking blood levels. In some cases, we may even leverage some of our new tools for measuring bone lead to understand the chronicity of lead exposure in different countries. There are clinical management guidelines for how to deal with individuals who are exposed to lead, but again, prevention has to be the baseline strategy for most countries. And of course, this will eventually involve multiple sectors, because it's not just the health sector, it's the sectors that are responsible for transportation, for product use, for importation of various industries, including the recycling industries, for spices and food products, so we can grapple, identify the sources of lead exposure and deal with them. It's this combination of research and surveillance will allow us to reduce lead exposure around the world. So in conclusion, lead poisoning is invisible. It impacts maternal and child health, causing irreversible silent damage to a child's development. Treatment is not an option, and we in the health sector have such a critical role to understand this problem ourselves, implement the surveillance and monitoring that allow us to understand the extent of the problem in our communities, and working with other sectors to mitigate the lead exposure risks, working with NGOs like Pure Earth and others to follow the trail of lead exposure. And this is how we can actually make a real dent in this problem worldwide. Thank you very much.
Thank you for that very concise and compelling presentation, Dr. Yu, which gives us a clear understanding of why exposure to lead has such dramatic effects on our health and why it poses a particular threat at such low levels even to young children and their neurodevelopment. And also thank you very much for emphasizing the cardiovascular impacts, which have perhaps not been so well appreciated till date, and the associated economic loss. Lead is one of the most studied environmental chemicals and by far the chemical with the largest quantified health impacts. It remains a challenge to understand why we still witness complacency, It remains a challenge to understand why we still witness complacently complacency despite the availability of proven interventions and the huge health and economic benefits that would accrue. WHO has been advocating for increased action to prevent lead poisoning for more than 2 decades and has been called upon to support massive outbreaks of lead poisoning in several countries. For example, an outbreak in West Africa, in Zamfara, which saw 150 children die. Treatment of survivors continues 14 years later. As WHO, we have a wealth of specific materials on the prevention of exposure to lead, its health effects, and clinical management, and this also includes briefs for policymakers and information for advocacy through a dedicated website. WHO also holds an annual International Lead Poisoning Prevention Week each year in October to galvanize action and advocate to governments, civil society organizations, health partners, industry, and others the unacceptable risks of lead exposure. 2024 will be the 12th year of campaigning. And WHO has published key guidelines for the clinical management of exposure to lead, as well as on key prevention topics, for example, lead in drinking water. The elimination of lead in petrol has been one of the major public health successes of this century. We've also shown successes in eliminating the addition of lead in paint, working with over 40 countries under the WHO UNEP Global Alliance to eliminate lead paint. We know that there's still half the world with no laws to prevent lead in paint and multiple sources of potential exposure through lead in water systems, lead in a number of consumer products, as well as exposure in mining operations and dismantling of lead-acid batteries. WHO is committed to work in collaboration with UN partners on taking every opportunity possible for scaling up action at country level. But we also have a political opportunity at the moment, with the G7 environment ministers having recognized lead as a major threat to human health and the environment, and it was taken up in the G7 Environment Ministers' Communiqué in 2022 and in 2023, where they recognized the need to cooperate more strongly, including with the G20. As part of the G7 ministers' action, the US and Germany led a series of expert workshops, which included a stocktake of actions and possible next steps. And there were 4 main recommendations coming out of these series of workshops. First of all, strengthening institutional capacity in low middle-income countries to develop, implement, and enforce domestic actions to prevent and reduce lead exposure. Secondly, encouraging safe use of safer alternatives. Thirdly, increasing awareness. And finally, also looking at improving monitoring and surveillance. And as already mentioned, the USAID Administrator Samantha Power called for a renewed global effort to eliminate lead from consumer products at the 2024 World Economic Forum. She advocated for a global drive to support low and middle income countries in rolling out and enforcing binding regulations to curtail lead in consumer products such as paints, spices, and cosmetics. And USAID pledged to work in more than 80 countries to advocate and support lead mitigation efforts. So that's why we are here today and why this is co-hosted by USAID as well as with UNICEF. And I'd like to call Atul Gawande back onto the stage and the panel members for the upcoming panel.
The panel members can join me on stage here. Minister Pate, I'll have you join here. Vice Minister Ike, I'll have you here. You can maybe take the last seat there at the end, and Mohammed, will ask you to take, no, sorry, Minister Pate, and thank you. Terrific. Well, I want to launch in by noting that, as I said, massive impact at a level that we're only now starting to recognize as a health community needs greater focus. Evidence that it can be tractable and clearly has been neglected. So I want to turn to Minister Pate to lead us off. And your government has committed to phase out the global manufacturing, sale, and import of paint containing lead. Only 7 other nations in Africa have developed lead paint regulations, according to the WHO. And the commitment of the government of Nigeria is so significant because you're such a leader in the African community. You're the ECOWAS chair, and the opportunity to lead by example is so important. Why have you taken on this problem of mitigating lead as an important issue in Nigeria?
Thank you. I think for us in Nigeria, the steps have been taken, but that's not enough. So just to say, that's just the first step. Given our population, given the youthfulness of this population, the growth that it has, the human capital of the country is the key asset that we have to harness. And certainly with the realization, and which is increasing, I'll have to say that it's just starting. There's a lot more that we can do to prevent, but also to deal with the acute issues that we have in parts of our country regarding lead exposure and lead poisoning. So the regulatory side, what you mentioned, I think is a good step. That's mostly through Standard Organization of Nigeria. We have the Director General of NAFDAC, who is the regulator, the FDA of Nigeria, who is here. On the food safety side, I think we're trying to put in place mechanisms that I hope will also advance that. The advocacy and the sort of policy levers at all levels and the multisectoral partnership that is necessary will have to come into play. And then the acute issues that we're facing in Zamfara. Incidentally, Mohammed here and I first met 10 years ago, 11 years ago, I believe, in Zamfara around the crisis of acute lead exposure from artisanal mining. We still have that. So yes, we've taken, let's say, an initial important step, but there's a lot more that we can do. And coming out of this conversation, even myself, I think the realization has sort of gone even deeper, that we'll have to convene the various sectors in Nigeria to address it in a more holistic manner, given the evidence that has been presented here. And in ECOWAS and also in the continent, I think we'll just add our voices so that we deal with this low-hanging fruit of preventing lead exposure, given the implication that it has. Yeah.
Couple important things you said. One was recognizing that whatever is the first action, now you've taken on paint, it's the beginning of a set of efforts. I think you also talked about working across sectors. And can you say a little bit more? You've named, your president has named a lead coordinator. I believe that's you. I'm not sure. You have to tell me. But, health can't do it alone. Environment can't do it alone. It involves regulation and then enforcement of regulations. Can you comment on what the lead coordination is for the government that other governments might be able to learn from?
So I think, given the fiscal federalism that we have, you have to realize that in the context of Nigeria, it's sort of sectoral. So there's the mining sector at the federal level, the industry, trade, the regulation, SON, the health sector regulated by our FDA that is here under the Ministry of Health, as well as Ministry of Environment, and the subnational, because some of the artisanal mining, the exposure, the states also have an important element on that. So I think we have to still work on that coordination across different levels, not only across sectors. So that's where I think we still have some work to do.
Great. Well, thank you. I want to pick up now the conversation with Dr. Sabina Flora, the Additional Director General for the Ministry of Health in Bangladesh. Bangladesh has really been a standout in showing the ways that you can drive collaboration and planning to actually demonstrate success. Can you talk a little bit about your ministry's role and engagement in the process to accomplish what you've accomplished? You might have to describe a little bit of what you have accomplished so far, which has been remarkable.
Thank you very much. First of all, let me thank the organizer for inviting Bangladesh, and thanks to USAID and UNICEF for working with us in dealing with this lead issue. Actually, my Honorable Minister was supposed to be here, but he has to leave today. So I am going to convey his message. Actually, it's not mine. Let me read out what he have communicated to you. Just a second. An estimated 35 million children in Bangladesh are affected by lead poisoning, making Bangladesh the world's 4th highest rate of death due to lead exposure. Each year, Bangladesh loses around 6% of GDP from reduced earning potential among those exposed to lead pollution. To combat this issue, we formed a technical implementation committee at the Directorate General of Health Services to coordinate the lead poisoning prevention program along with UNICEF, PureEarth, and other NGO partners. We needed additional evidence to guide policy decisions. In 2022, we analyzed health system readiness and overall capacity to deal with heavy metal poisoning, testing capacity, supplies to identify and monitor children with elevated blood lead level, and public awareness. We found gaps in awareness of lead poisoning, as well as capacity to address it throughout the health system. With UNICEF support, we began to address these gaps by developing and disseminating national guidelines on lead poisoning prevention and management, as well as social and behavior change messages and materials. We still had many questions about sources of lead poisoning and the burden of elevated blood level through one of our epidemiology institute known as Institute of Epidemiology, Disease Control and Research. In collaboration with UNICEF, a study was conducted in 2022 in 4 districts where we measured blood lead level in children and found that all the children tested, it was not a big size, 980 children were tested, had lead in their blood. Although we expected lead in the blood of children around used acid-lead battery sites, children living even in far from these sites also had high blood levels, which means battery sites are not the only risk factor for lead pollution. To better understand the source of exposure, we conducted a follow-up home-based assessment of sources of lead exposure for a selected sample of household of children from in 2022. The findings revealed that informal used lead acid battery recycling, painted surfaces, and metal containers were significant sources of lead exposure in children. In 2021, we have used World Environment Day in June and International Lead Poisoning Prevention Week in October to share evidence, raise awareness, and advocate for ending childhood lead poisoning in collaboration with other sectors, including the private sectors. We have demonstrated the government of Bangladesh commitment to leverage funding for lead poisoning program by including lead poisoning prevention and children's environmental health issue in our fifth health sector program and operational plan. Let me explain. Our health system are running by 5-year plan. Though the next 5-year plan would be starting from July, which is fifth sector program. And in this fifth sector program, the activities related to mitigation of lead poisoning is being included. The ministry is working with the Bangladesh Bureau of Statistics on heavy metal analysis of 4 metals, specifically including lead and others are arsenic, mercury, and cadmium in children and pregnant women, including as a new module in 2024 multiple indicator cluster survey. Thanks to USAID for funding support through UNICEF to conduct a national analysis of this area. Regarding working with other ministries, Bangladesh has a very strong platform, One Health platform, where mainly Ministry of Environment, Forestry and Climate Change, obviously Ministry of Health, Ministry of Livestock and Fisheries, Ministry of Agriculture are working together. So Ministry of Health is already with us, and along with these ministries, other concerned departments like Bangladesh Standards and Testing Institution, Bangladesh Food Safety Authority, and many other private organizations, academia, business bodies are included in our activities. Ministry of Health collaborated with Ministry of Environmental Forest to organize a high-level national advocacy event in 2023, and this year also we planned for a high-level advocacy meeting, which is planned to do on next 6 June on the occasion of this World Environmental Day. We have another institute known as National Institute of Preventive and Social Medicine, which basically is a training institute and offers post-graduation courses in different public health subjects, including environmental health. And we have started fellowship program there to build human resource capacity, and that is also with the support of UNICEF. We're doing that. And in that, along with this heavy metal poisoning, other environmental issues are there, including air pollution, noise pollution, all these. So we organize, as I was saying, that we organize regular meetings of One Health Network, where these lead poisoning is very much discussed to identify our action item. So we have organized orientation for the policymakers so that they can understand and realize the need, and specifically Department of Primary Education, and include these issues in the national curriculum so that people get aware even from the very beginning of their life. I would stop here, so if you have any more question. Thank you.
Thanks. I'll just comment on the comprehensiveness of the work that you're doing now in Bangladesh. You are measuring the levels in surveys in the population generally, and now tracking how many children have elevated lead levels. You found spices were a major source, with spice sellers adding lead because it makes the colors brighter. That's why people use it in paint, but also in spices, and also it's heavy, so you sell more spice when you sell by the pound. And you really took action, measuring on the spot, bringing television cameras to expose that sellers who are doing this work. And rapidly, within a couple of years, it was gone from spices, and you had significant reductions in DACA. And now you're taking on lead acid batteries, which is an even bigger problem in many countries. As we go to a low carbon world, we are in a high metal world, and lead acid batteries are a next major area. And your work establishing an industry life cycle responsibility, that the battery manufacturers are responsible for the full life cycle of the battery, is something we will learn from. I want to now turn to Mohammed Abdulaziz from Africa CDC to say a little bit about the role of regional engagement and leadership, if you could, Mohammed.
And thank you, Atul. Thank you so much. And let me say thank you to you, USAID and UNICEF for inviting Africa CDC to this, and joining myself and Professor Pate, who many years ago in Nigeria, 2010, were responding to the biggest lead poisoning artisanal that ever came out of Nigeria. So at that time, because the experience of that time is important to guide what regional institutions like Africa CDC is doing or will do. So at that time, in multiple local governments in Zamfara State, we went there and more than all the children under 5 had lead poisoning of 45 micrograms per deciliter and above, which is the yardstick for chelation therapy by the US CDC. Now, how did that massive outbreak came into be? It was because the MPACDA at that time was doing a polio program, and they went there, they complained their children were dying, convulsing and dying. And then investigations from MPACDA went, and they discovered it's not polio, but it's lead poisoning. Importantly, when you look at the JEE finding, the WHO JEE, Joint External Evaluation finding, chemical and radiation thematic area consistently has major gap in most countries that were evaluated in Africa. So it means we cannot have stand-alone processes. How did Nigeria get to know of that outbreak? It's because of a strong national public health institution that is multi-hazard facing. Because all of those different areas, surveillance, lab, were housed within a very strong national public health institution. So it came together, and with the very strong leadership of Dr. Pate, who went there, attention got to that outbreak and response started. So what Africa CDC is doing right now is to work with partners to strengthen national public health institutions like NCDC, MPACDA, Liberia National Public Health, Ethiopian Public Health Institution, to be able to bring the various essential public health thematic working areas under one roof, so that they will be able to use the various resources they have for the different hazards that can possibly face come. And it means, as we're strengthening surveillance, which is key to finding out outbreaks or massive environmental contamination like the one in Zamfara, you must be able to have people who can pick it at the earliest time, not like when it is already there for many years and we're only picking it when we are realizing that children were coming up with low IQ, like said earlier by some of our speakers. But we pick it at the time so that we can do environmental remediation. We can separate children and mothers from the contaminated environment, and not treatment. Treatment is not an option for lead therapy. And how do we do that? Again, Atul, that goes to what we are doing with you, UNICEF, on the community health workers. We must investigate every case of unusual children death under 5. And part of that investigation must involve checking for the role of environmental contamination like lead. We must. Because if it's not infectious diseases, it must be something from the environment. And to do that, community health workers are the best to sit in that space when they notice unusual high number of deaths within their community. Don't forget, they are in the community. When they report this and investigation comes, if it comes out that the infectious disease is not a major, then the onus lies on the National Public Health Institution, which have been strengthened, to now evaluate for the role of environmental contaminants. So these are some of the things, and I believe what we're doing to raise the number of community health workers in 20 countries by 500,000 is very key, and I know Dr. Pate is also very strong on the use of community health system to improve what is happening in Nigeria. And Africa CDC will be supporting that in many of our member states. Thank you.
Thank you for bringing in the role of the National Public Health Institutes, because it often is the public health sector that identifies where the major sources are coming from. You know, you have to follow up on the elevated lead levels that are seen and then demonstrate the sources, and that engages the entire government to make the difference. I want to pick up now with Dr. Huang, Vice Minister of Health in Vietnam. Vietnam has made significant strides by working on phasing out lead-containing paint and also preventing exposure from lead-acid batteries. And I wonder, what are the challenges you're finding you're taking on and how you're going about this work in Vietnam?
Thank you. Good morning, everyone. First of all, I would like to thank organizer UNICEF and USS to invite me and our colleagues to this important meeting. And recognizing the...
Il faut reconnaître l'impact de la toxicité du plomb pour l'environnement et pour la santé humaine. Et nous avons fait beaucoup d'efforts pour contrôler et pour réduire les effets nocifs sur la santé et sur l'environnement. À l'Assemblée nationale, nous avons déjà discuté des lois, par exemple une loi sur les produits chimiques, loi sur la sécurité et loi sur la protection
medioambiental.
Réglementation pour éliminer le plomb dans l'essence et dans les biocarburants, et aussi réglementation et normes pour le plomb des aliments, dans les aliments, les peintures, dans l'eau potable et dans l'eau de déchets.
And electronic products, including household appliances, toys, ambient air, environment and working environment, etc. And also the government already assigned clear management responsibility for different ministries, sectors and localities.
Dans les secteurs locaux, dans les efforts d'aborder l'exposition du plomb, nous avons maintenant en train de relever des défis. Le premier, c'est l'organisation et aussi les individus qui ne respectent pas les réglementations et donc qui mènent à une augmentation de la pollution, de l'empoisonnement par le plomb et qui affecte les êtres humains. Dans certaines études au Vietnam sur l'empoisonnement par le plomb, et où le niveau de plomb dans le sang des enfants est élevé dans certains secteurs, représente un pourcentage élevé, par exemple dans les sites miniers, et surtout quand le recyclage de batteries de plomb acide. On a beaucoup d'industries artisanales qui font ce recyclage manuellement. Et
serious lead poisoning in called Dong Mai Lead Village. More than 100 children got lead poisoning with the lead blood level more than 10 microgram. And the second is the knowledge and understanding of people, production facility owners and workers about lead exposure and its impact on health is still limited. The third is now we have no regulation on lead limits in some products, especially traditional medicine. And according to statistics from the National Children's Hospital, 96.2% of children admitted to the hospital who had lead poisoning is exposure to the traditional medicine. But until now, we do not have a lead limit for that medicine. And the fourth one is the financial resource for the preventing lead exposure and lead poisoning in children is still limited. And I think the most important thing is currently Vietnam has no national survey report on lead exposure and lead poisoning in both adult children and pregnant women. So that's a very big problem. So yeah, and then to ensure the direct impact on health is understood and prioritized across all sectors that have a role in prevention. I think we have to, the Minister of Health will do three important actions. The first one is we would like to carry out a national survey on lead exposure and lead poisoning in both adult and especially for children and pregnant women, including cost effectiveness and analysis and assessment on cost effectiveness if the prevention solution is not implemented. And this survey result will be a basis for our communication advocacy and to implement the measure for reduce lead poisoning impacts. And the second thing is we strengthen communication for people to know about the lead exposure sources and impact of lead poisoning, etc. And the third one, we would like to strengthen measures to check, monitor, and inspect the compliance with regulation on lead exposure. Yeah, thank you.
Thank you for demonstration in Vietnam of what is possible as well. I think you hear from these leaders that there is not only the awareness now growing, but that there are actions that can be taken. We cannot do it with just the country leaders alone. We need civil society engaged. And as a final word, I want to turn to our virtual participant, Dr. Laura Ortego Ibanez of Philippines and the NGO Pure Earth for a final couple of words. Dr. Laura?
Thank you, Dr. Gawande, and I'm pleased to join you today to speak on this important topic, the role of civil society in driving action. One word, because I have time limit, help meters. Where there's a need, there's a CSO ready to help do that part of the job. And that's what led Pure Earth to do this 25 years worth of work and to focus more on lead in the recent years. I'd go straight and specific with 5 specific roles, how CSOs can do this help meeting. I'll start with dependable data collectors. Typically, in low and middle income countries, there's a lack of data on lead exposures. And this is crucial because we cannot act on what we do not know. So in the case of Pure Earth Philippines, we approached the government to include blood lead level screening in our national nutrition survey. In this, though limited in scope, yielded the country's baseline data on blood lead levels for the 6 to 9-year-olds. And we followed through with rapid marketplace survey and home-based assessments so that we can identify potential sources of exposure. I cannot overemphasize the need for data, not just in understanding the problem, but also in deciding on the solutions later on and measuring the impact of interventions. Second would be pilot demonstrators of an intervention. In our previous toxic sites, levels would be as high as 50 micrograms per deciliter for children. But the nationwide survey showed that our BLLs have gone lower at 1.96 micrograms per deciliter. That's lower compared to the action levels and even lower than our other low and middle income countries. But compared to the US for the same age group, which is 0.5, that's still very high. And as Dr. Howard Hughes mentioned earlier, there's really no safe level for lead. And so by estimates in the Philippines, there's 1 million Filipino children at risk at these levels. That's 1 million futures. And that's how I would like to encourage all of us to look at these numbers. Then, as to sources, aside from the usual ones, we found out that our metal footwear and ceramic footwear have consistently high lead levels, and we need a more comprehensive source assessment, but surely there's exposure right in the homes of these children. So what did we do? First, we have to pilot, demonstrate the process, from the survey to the feedbacking to the health assessments, to the rapid marketplace survey, and also home-based assessments, because otherwise these steps of the process would be seen as impossible to accomplish. In countries like ours, there's a need for organizations to take the lead, to show what can be done, how, and why. Now, it depends on the situation and source. Pure Earth has a lot of stories from other countries on spices and ceramics, as well as cleaning contaminated sites. Third, champion communicators. As much as possible, publish the data so it can be used for further studies and also for policy making and programming. Always make it a point that those who need to know so they can act. We have the families and the communities, the schools, government on all branches and levels, the industries, and also the international development community to communicate with each group, requiring an appropriate level of information and a relevant call to action. And note that we cannot simply disseminate information without a ready response. We cannot tell people you're being poisoned and I cannot do anything about it. We have to be responsible enough to say, yes, you are being poisoned, but we have solutions and we're here to help. We don't want to create panic. We want to inspire hope in dealing with this problem. Fourth, cost-effective capacity builders. This is typically through trainings, provision of equipment, development of protocols, technical assistance, and so on. In the case of lead monitoring and surveillance being key in early detection and early intervention, we advocate for the capacitation of the primary healthcare units. They are the frontliners, and if these units can help us raise awareness on what is lead, its impacts, its sources, its mitigation measures, that's a big help already. What more if they are trained and equipped to do blood lead level screening and home-based assessments? They can serve as our case detectors right on the ground. Then a referral system can follow, and also same goes with source identification and intervention. Last but not the least, collaborative integrators. If we want these efforts to be sustained, we have to work towards incorporating the lead issue in existing policies and programs, say, including blood lead level screening in our universal healthcare packages, lead awareness in the school curricula, or lead-free labeling for consumer goods that are of concern. And most importantly, institutionalizing a national surveillance system, because regular data gathering ensures that we are on top of the issue and we can respond appropriately and not blindly for hotspots and non-hotspots, because preventive rather than reactive is still the best approach. It makes absolute sense to prioritize hotspots, but if we will not do something for the non-hotspots, then they will be in the same predicament and it will be harder to solve. That's why in the Philippines, we have included specific lead action points in our National Environmental Health Action Plan through the Interagency Committee on Environmental Health. If this comes to fruition, Philippines will be well positioned to address lead exposures and prevent it from worsening. Now, let me catch my breath and just slow down with this last few lines. I believe that all of us are here today, not incidentally, but intentionally, because of the values we believe in and the values we live by. I crave saying you have such positions of power and, most importantly, purpose. And I sincerely hope all of you will use your roles as health leaders to drive action towards lead-free futures. Thank you very much.
Ibanez, thank you so much. It's a wonderful way to wrap up this panel. I appreciate everybody's contributions. Thank you. Anshu.
Thank you very much. That was a wonderful panel. And we're coming close to the end of the program. I just want to remind everyone that there is a shuttle for you to go to the World Health Assembly afterwards. But before that, I would like to introduce a video that we're going to play. recognizing the urgent need to empower all healthcare providers to safeguard children's health amidst the challenges of environmental pollution and climate change, WHO and UNICEF together have collaborated to provide a free online course that really looks at children's environmental health and looking at different areas such as global concern for air pollution, but also climate change, e-waste, lead is included, pesticides and other health hazards. And the course addresses a pressing need within the health sector where many providers have limited knowledge to recognize, assess and manage environment-related diseases in children. And that will be followed by closing remarks by Ted Chaiban, who's the Deputy Executive Director at UNICEF.
Around the world, environmental pollution and climate change are having a growing impact on children's health and children's lives. I'm Kathy Russell, UNICEF Executive Director.
I'm Tedros, the Director General of the World Health Organization. More than a quarter of death and disease in children under 5 years of age is attributable to unhealthy environments.
We all have a responsibility to create a healthier planet for children. The health sector has an especially crucial role to play, and that starts by making children's environmental health a priority.
WHO and the UNICEF have come together to create this free online course for health workers outlining what they can do to protect children's health from pollution and climate change.
This course provides an overview of the field of children's environmental health, focusing on toxic metals and chemicals, air pollution, climate change, and other hazards to children's health.
It will equip you with the knowledge you need to protect more children.
UNICEF and WHO believe that every child has the right to grow up in a healthy environment.
The health sector can help realize that right and help us to safeguard the health of every child. I thank you.
Good morning, and thank you to the panel. Thank you to the organizers. It's been an excellent, excellent event, an enriching discussion. And I'd like to thank in particular USAID and WHO for helping organize this important ministerial dialogue. As we've heard today, childhood lead poisoning is a hidden crisis that we need to address, with 1 in 3 children having elevated blood lead levels, leading to neurological damage, lower IQ, diminished academic achievement, and behavioral problems. But as we also heard today, the participants from the governments of Bangladesh, Nigeria, and Vietnam, our civil society colleague from the Philippines, have clearly indicated that this is a danger that can be addressed. Lead poisoning is a solvable problem. It takes hard data from national surveys to ensure evidence-based and effective interventions, and UNICEF and USAID can help in this regard. It takes strengthened enforcement of existing laws and policies and enacting new ones as needed to end the use of lead-added containing products and unsafe industry practices. We heard about lead-acid batteries, we heard about cosmetics, about spices, about paint. And it takes awareness campaigns to elevate the public awareness and recognize the dangers and prevent exposure. And finally, it takes investing in health and education systems to provide improved care and management of children who suffer developmental delays caused by lead exposure. And as we have also heard today, this requires a whole of government approach. Ministries of health can join with ministries of education, environment, industry, economic growth, and other sectors to advocate with top government leadership for high-level prioritization and coordination to prevent lead exposure, to develop a multisectoral action plan to address lead poisoning, and to appoint a high-level national focal point for lead coordination. At the global level and as international partners, let us continue to raise awareness and ring the alarm bell at the UN General Assembly, the World Health Summit, and other international fora. Let us support countries to address lead exposure and the needed mitigation efforts by mobilizing resources, by providing technical support, and by investing in research to develop innovative tools to better detect and prevent lead exposure. And I want to give a shout out here to the point that Muhammad from Africa CDC made about the importance of tying some of this work into the big effort we're making to strengthen primary health care and to lead a world where we have paid and protected community health workers who can address a wide variety of issues, including this one. From the UN, the three agencies that are involved are UNEP, UNICEF, and WHO, and we commit to work with USAID and other partners to address this issue. Let's join hands, leading the charge with unwavering commitment from all sectors. Together, let's translate these discussions into action. We can have a world free of lead exposure, a future where every child can reach their full potential. Let's make this the turning point. Let's make it happen. Thank you very much.